As I mentioned earlier, there are several antibody drug conjugates which are approved for breast cancer, urothelial cancer or bladder cancer, lung cancer, ovarian and cervical cancer. But I'm going to discuss more about the side effects of antibody drug conjugates in breast cancer. Breast cancer is one of the most common cancers that is seen in females, and it is a second most common cause of mortality. And breast cancer is one of the cancers for which several antibody drug conjugates are approved for. So let's look into the side effects of antibody drug conjugates in breast cancer. So one of the most common antibody drug conjugate that is recently approved in breast cancer is Trastuzumab Deruxtecan, or we call it as TDXT, or the brand name is Enhertu. I'll be calling Trastuzumab Deruxtecan as TDXT in this presentation. So as you can see here, this particular antibody drug conjugate is designed specifically to go and attach to a particular antigen that is seen in the breast called as HER2. So this HER2 is expressed in the breast, and also HER2 is expressed in other areas such as lung, stomach. Therefore, the side effects when we use this TDXT, the side effects that we generally see is because this TDXT is going to attach the other areas which has the HER2 targeted antigen expression. So TDXT is approved in addition to breast, it's approved in gastric cancer and also in lung cancer. The most common side effects from TDXT are it can cause diarrhea, it can cause decreased cell counts, or we call it as cytopenia. Then it can cause chemotherapy-induced nausea and vomiting. It can cause hair loss. But most specifically, one of the serious side effects that can happen from TDXT is ILD, or interstitial lung disease. So let's see what interstitial lung disease means. So as you can see in this figure, this is the normal lung and alveoli. This is our normal lung, and these small air sacs that you see here is called as alveoli, or air sacs, or air-filled sacs in the lungs. So in interstitial lung disease, what happens is these air sacs, they become irregular and they become abnormal, and there will be like a lot of scarring or fibrosis that can happen in this alveoli or the air sacs, which leads to decreased exchange of oxygen from the normal cells, from the blood vessels to the normal lung cells, which leads to decreased oxygen in your body. So this is what we call as interstitial lung disease, which is a serious condition because it can affect the oxygenation in your body, which leads to several complications. And this is one of the very serious side effects that can happen from TDXT. Although it's not very common, it is a serious side effect that we all need to know as providers, and you need to know it as a patient as well. So let's look into the symptoms of interstitial lung disease. So most of the time, patients with interstitial lung disease, they present with a dry cough, or sometimes when it's severe, they can present with shortness of breath. They can have chest pain, and they feel very tired, or they always feel like very fatigued. And when the oxygenation in the lungs or in the body, when that's affected, you may be presenting with a bluish discoloration of the skin, lips, or nails, which we call as cyanosis. And sometimes you will feel like you may be having weight loss. But most of the time, patients will be presenting with a dry cough or shortness of breath, which is what we see in the clinics. The main reason why I am mentioning the symptoms is interstitial lung disease is one of a serious condition that can happen from the antibody drug conjugate Trastuzumab Deruxtecan or TDXT. So if you're taking this drug for breast cancer or for any other cancers, and if you are experiencing any of the side effects, you need to see your provider as soon as possible. So let's look into the scan findings or the imaging findings that can be seen in interstitial lung disease. This is a CT finding of a normal lung. You can see in the middle portion, that's the round structure that you see here is your heart. And on both sides of the heart, you can see your lungs. This is a cross-sectional view of your lungs. This is what we call as normal lungs. This is how your lungs appear in a normal CT scan. And this is what we see in interstitial lung disease, where you can see that on this lungs, you can see a lot of scarring, all these white areas in that dark background. That's all like scarring. Sometimes it can be like honeycomb shaped, but it can cause scarring, fibrosis, and there can also be some fluid collection in the lungs, which is what you see here on the left lung area. So this is the picture of your lungs that you can see in the CT scan if you develop interstitial lung disease. So it's always better to report your symptoms upfront so that we can catch the interstitial lung disease before it becomes very severe. Let's look into the treatment of interstitial lung disease. So we called it as 5S. And it's a way in which we can remember what to do when we are suspecting interstitial lung disease in a patient. So the first S stands for screening, which means if you are giving the Trastuzumab Deruxtecan to a patient, and if they are reporting dry cough or shortness of breath, you need to get scans immediately. And before that itself, in the screening phase, you need to screen the patients appropriately so that you can select the patients who will be a good candidate for TDXT, which means it's usually patients who does not have any other prior existing lung conditions. Because if a patient is already having a prior existing lung condition such as COPD or any other shortness of breath or rheumatoid lung conditions, then that patient might not be a good candidate for getting TDXT. So the first step is screening of the patients. Once you screen the patient and once you select the patient for receiving the TDXT, then if you are having any shortness of breath or dry cough while you're getting TDXT, you need to get scans for the patient. Initially, you scan the patient before you give them the TDXT. And after that also, it's advisable to repeat the scans every 6 to 9 weeks while you are getting TDXT. And especially if you are having interstitial lung disease or any symptoms of interstitial lung disease, the frequency of the scans may vary. And the treatment is usually a teamwork because it needs not only the treating primary medical oncologist, it needs a pulmonologist. It also needs several other team members to help with your symptoms and to help with the treatments. And based on the grade or the severity of the interstitial lung disease, we may have to stop the treatments or we may have to hold the treatments for some time. And the main treatment agent that we use for interstitial lung disease is steroids. And there are several dosing of the steroids that we use based on the severity of the interstitial lung disease. But if you have any of the symptoms of interstitial lung disease, report that to the physician. Then we will get scans and we will measure your oxygenation in the lungs. And then we will grade your degree of the interstitial lung disease. And we will be either holding the treatments or we will be decreasing the dose of the medicine or we will be even stopping the medicine completely if that's a severe interstitial lung disease.